maybe the most important time to step up. And they did, and then we hit the goal in March because of an incredible group of volunteers, an incredible group of staff, and a caring community, great generosity, and we hit that $40 million goal. Personally, I was grateful. I was amazed. A little tired. I think we all were. But we were already recruiting for this year. David's taken up the challenge. But to get to 40 million, all these incredible corporations that were facing furloughs and layoffs and organizations that had to cut back and individuals who, again, it was so easy. But to get to be a $1.5 million gap, we had all those people up to December getting us to $38.5 million. So it was built on the shoulders of great generosity and caring. And again, it would have been so easy. Let's travel back in time a little bit and talk about how this United Way, and it's actually been a kind of a national movement, but this United Way approached its new funding strategies. It was an important time, and it is an important time in our work. It's so easy to just keep doing what you're doing. That's easy. No controversy. Everybody loves you. May not be the right thing to do, but we approached it from looking at what are the needs of the people in the community. 4 years of research, 4 years of involvement of volunteers, agencies, professionals, consultants, tremendous staff expertise, and put together a strategic direction based on the needs of the community. In fact, many United Ways are concentrating on three broad buckets: income and health and education. And most of what we do is aligning with that. But we approached it a little bit differently. We did a lot of research up front, a lot of conversation, a lot of engagement. We're in the third year of our funding cycle. And if anybody from Greater Cleveland would remember, when we first announced our new funding, most everybody thought it was the right approach. The board thought it was the right approach. The volunteers thought it was the right approach. But there were some that said, you know, well, what about me? And we said, it is about all of us. It is one community. And we have to look at what the needs were. Look what we were facing in late 2007 and 2008, and it's continued. People facing foreclosure. People facing hunger. People facing kids that couldn't get daycare. So we set about this course that Paul mentioned and set ourselves in a position to try to respond to these needs as opposed to just history or emotion. We shifted a great deal of our money, interestingly enough, as the economy was changing and before it actually changed. We shifted a great, I believe it's 28% of all of our funding went into basic needs and economic self-sufficiency. Get people back to work. Take care of their immediate needs, get them into housing, get the food out there, get the help that they needed right now. So 28% of all we do through our partners and others, our funded agencies, our partner agencies, is dedicated to economic self-sufficiency and basic needs. Some of the things that we do include helping kids and their families stay the course and have a positive response to job training, to education, to get them prepared. Keep them on track academically and socially. We're helping to provide health care for the uninsured and the underinsured. Think about what has happened over these last several years, and that your United Way, at least here in Greater Cleveland, your United Way has tried to respond to what was going on. We also are offering a helping hand to those that have chronic health issues and mental problems. We've been in that game, and we're staying in that game because it's out there, it's reality. We've also worked really hard at having seniors maintain not only their dignity, but be able to be independent. People sometimes ignore that. We didn't ignore that. It came out in our research. It came out with the good brilliance of our experts. We've taken care of kids, and one of my grandchildren was born with a disability. And I can tell you, the United Way was there to respond, not because I happen to be the staff guy, but because that's what this network and these strategies do. And I remember after Mason was born, without a left arm below the elbow, getting a call from my son and saying he was born, and I was happy, and then the next word, but there's a problem, and he told me, and I cried. because you project what happens later in life. There are some cruelties out there. There's a lack of resources. A prosthesis costs somewhere in the neighborhood of $25,000 every time a young kid's body changes. So there was a lot of things at that moment. And you can see it still affects me. The good news is, because of our strategies and great organizations, that somebody sent me a book, the lady sitting in the front of the room, Pat Nobley, that said, After the Tears, we provide the infrastructure and the strategic direction to be able to not only respond to Mason, but the Masons and the Marys throughout the community. That's what United Way does. That's what we do, but we do it on a research base, an expert base. In fact, let me give you a couple examples of how we've worked together and we collaborate with others. An important new, we may not have been as collaborative as we could have been, but it is one community. We're all working towards the same end, and we need to come together as a town to get these things to happen. And I think it is the same all over the country. But one example, risky area, something that I don't know that we would have done before, that the board and the executives would have done. But each year, 5,000 approximately men and women return from being incarcerated. Doesn't make any difference whether you agree with it or you don't agree with it. They're coming back here to our county. And we have a choice to make. We can either let them out there to commit more crime because nobody's helped get them mental health, because it's not one thing. It's not just career counseling. It's not just handing them a pamphlet. It's putting, I call it, the surround sound, the surround services around them, whether it's drug abuse, mental health, education, family counseling. And so through a collaboration with Cuyahoga County's Department of Reentry, through the Cleveland and Gun Foundations, we have wonderful partners. Through our lead organization, in this case, the Center for Families and Children, we've put together an initiative so that they have a better chance of not repeating and not offending again. That's the kind of investment that your dollars will pay off. If you're mercenary and say you want to know what the return on investment is, let me tell you, the cost of maintaining somebody in a prison, in a halfway house, is pretty expensive. If we can return them to productive people and members of our society, we have a great, it's not only less expensive, but it's the right thing to do. And this is a community of doing the right things. We're just privileged to be part of that catalyst, that collaboration. Another one that we just kicked off is working with the Literacy Coalition, Literacy Cooperative, and Invest in Children to put a program together called Spark. And it's getting young kids prepared for kindergarten with reading exercises. We've gotten some grants, but SPARK stands for, and I'm going to read it, Supporting Partnerships to Assure Ready Kids. We know that if they're not ready to go, they're not going to be successful. And the ones that are most in need are going to be even less successful. And so through this collaboration with lots of folks, we've been able to put together a very laser-focused, targeted approach to getting these kids ready. Just last week, we all read, and then again this week, and yesterday on the radio, about our foreclosure rates. We were early in the game. I forget the number, but it was something like 5,000 or 7,000 new applications just were announced. But because your United Way has tried to stay focused on need and people, as opposed to just fundraising, we've been able to put together a collaboration with, you might have known it as Lutheran Housing, but Housing Solutions, and work together to work with families, particularly those families with children who are at most at risk of being foreclosed before they get in there and be foreclosed, because then what happens, and Dr. Sanders could talk about this and lots of others, then the families move from school to school to school. They may not even get to be educated at all, and it's a real terrible thing. And so working together through and with others, you got to be a good partner to have good partners, and we're trying to be a better partner here at our United Way. I've told you about some of the good news, some of the things we're doing, some of the excitement that we're doing around Greater Cleveland, but I would be totally remiss if I didn't mention that there's incredible need. Incredible need in our community, incredible need across the country. It's not just in the center city. It's not just in the urban center. It's actually in the suburbs.